cardiac output is the master number for blood flow. It's the total amount of blood pushed out by each ventricle per minute. And this number is what determines how much oxygen and nutrients are getting delivered to literally every cell in your body. Okay, so if cardiac output is the big picture, the flow per minute, then stroke volume is the smaller but equally important part. This is the specific amount of blood that gets ejected with each individual pump, each heartbeat. Think of it as the volume per stroke. So where does this stroke volume number even come from? Well, it's actually just some simple subtraction. The ventricle fills all the way up with blood, that's its end diastolic volume. Then it contracts, whoosh, but it doesn't empty completely. The little bit of blood that's left over, that's the end systolic volume. So the stroke volume is just what you started with minus what was left. And we measure the efficiency of that pump with the ejection fraction. A healthy heart pushes out about 65% of the blood it receives with each beat. All right, now we've got the pieces. We have the volume per beat, and we have the rate of the beats. So let's put them together and build the simple core equation that really governs our entire circulatory system. And there it is. It's that simple. Cardiac output is nothing more than the stroke volume, the amount of blood per beat, multiplied by the heart rate, the number of beats per minute. It's a beautiful, elegant relationship. If you need to change your total blood flow, you've got to change one of these two things. Okay, so the math is easy, but that leads to a much more interesting question, right? If cardiac output is just stroke volume times heart rate, what's actually controlling those two things? What are the knobs and levers our body is turning? It really boils down to these four main pillars. You've got venous return, that's the amount of blood coming back to the heart. You can't pump what you don't have, right? Then there's myocardial contractility. That's the raw squeezing power of the heart muscle. A stronger squeeze means a higher stroke volume. Third is peripheral resistance, or afterload. Think of this as the pressure the heart has to push against. The higher the resistance, the harder it is to pump blood out. And of course, heart rate itself. Your body is constantly playing with these four factors to meet your needs. Now, what's really fascinating is that beyond all that external control, the heart has this genius ability to regulate itself. It has a built-in feature to adjust its output on the fly, and this is all thanks to a fundamental principle of physiology, the Frank-Starling Law. I know, the official wording sounds a little dense, but the idea behind it is incredibly simple and intuitive. Just picture a rubber band. The more you stretch it, the harder it snaps back, right? Well, the muscle fibers in your heart work the exact same way. So let's just walk through it. More blood flows back to the heart. That's our increased venous return. This fills the ventricle up more, increasing its end diastolic volume, which we also call preload. That extra volume stretches those heart muscle fibers, just like our rubber band. And that bigger stretch results in a way more forceful contraction, which pumps out a bigger stroke volume. It's a perfect feedback loop. What comes in, goes out. But wait, how does all that blood get back to the heart in the first place, especially from your legs? It's fighting gravity. Well, it gets a lot of help. The two big players are the respiratory pump. Every time you breathe, pressure changes help suck blood toward your chest, and the skeletal muscle pump. When you walk, your leg muscles squeeze your veins and push that blood right back up. These are absolutely critical for keeping this system flowing. So here's the key takeaway for any future clinician. Cardiac output isn't some fixed number. It's always changing, always adapting, and understanding why it changes is a massive clue for diagnosis. So let's look at when this engine revs up or slows down. Anything that makes your body demand more oxygen, like exercise, pregnancy, even just feeling anxious, is going to ramp up your cardiac output. Certain diseases, like fever or anemia, do the same thing. On the other hand, it can also drop. Just standing up from a lying position can cause a temporary dip. But more seriously, scary stuff like a major hemorrhage or heart failure causes a dangerous fall in cardiac output because the pump is failing or there's just not enough blood to move around. This is all great in theory, but how do we actually use it in a hospital? We know cardiac output is a huge deal and we know it changes. So how do doctors actually get a number on it from a patient? One of the classic ways is based on this really clever idea called Fick's principle. It's basically an accounting formula for your body. If you can figure out how much oxygen your lungs are adding to your blood, and you measure the oxygen difference between the blood going into and out of the lungs, you can calculate the total blood flow needed to transport that oxygen. And when you rearrange that principle, you get this formula to solve for flow. And because we're talking about the lungs, which handle blood flow for the entire body, this flow is equal to our cardiac output. It's a brilliant indirect way to see how well the heart is working.
Of course, these days, there are plenty of other ways to do it. The dilution method is a similar idea to Fick's. Thermodilution is pretty cool. You inject some cold saline and measure how the blood temperature changes downstream. And now we have amazing non-invasive tools like Doppler echocardiography, which uses ultrasound to literally watch the blood flowing and measure it directly.
And that brings us to the end of our deep dive. So I'll leave you with this to think about. In an emergency room for a patient with severe trauma or a massive infection, how could tracking this one single number, the output of the body's engine, guide every decision you make, from giving fluids to choosing medications, and maybe even save their life?